Today, we're diving into a super important topic that could potentially save lives, recognizing the early symptoms of a stroke and understanding how to treat it. Stick around because this information could be crucial for you or your loved ones. Let's get started. Did you know that symptoms of a stroke can appear up to 1 month before it occurs? Stroke, or CVA, is a medical emergency, just like a heart attack, so it's important to know the signs of a stroke and act quickly if you suspect someone is having one. It's crucial to acknowledge that recognizing and addressing a stroke early can significantly enhance the likelihood of complete recovery, underscoring the importance of being familiar with these symptoms. A stroke happens when the blood supply to part of your brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. Brain cells begin to die in minutes. Recognizing the signs early can make a huge difference. Here are various risk factors that elevate the risk of experiencing a stroke. 1. High blood pressure. Hypertension is the leading risk factor for stroke. It damages blood vessels, making them more prone to blockages or bursting, which can lead to ischemic or hemorrhagic strokes. 2. Stress and depression. Chronic stress and depression can contribute to stroke risk by increasing blood pressure and promoting unhealthy lifestyle choices like smoking and poor diet. 3. Smoking. Smoking damages blood vessels and raises blood pressure, significantly increasing the risk of stroke. It also reduces oxygen in the blood, which can lead to clot formation. 4. Diabetes. Diabetes increases the risk of stroke by contributing to the buildup of fatty deposits in blood vessels, which can cause blockages. High blood sugar levels also damage blood vessels and nerves. 5. High cholesterol. High levels of LDL cholesterol can lead to atherosclerosis, where fatty deposits build up in arteries, reducing blood flow to the brain and increasing the risk of ischemic stroke. 6. Physical inactivity. Lack of exercise contributes to obesity, high blood pressure, high cholesterol, and diabetes, all of which are stroke risk factors. Regular physical activity helps maintain healthy blood vessels and heart. 7. Heart disease. Conditions such as atrial fibrillation, heart failure, and heart valve defects increase the risk of stroke. Atrial fibrillation, for instance, can cause blood clots to form in the heart, which can travel to the brain. 8. Excessive alcohol consumption. Heavy drinking can increase blood pressure and contribute to obesity, both of which are stroke risk factors. Binge drinking, in particular, can lead to sudden increases in blood pressure. 9. Previous stroke or transient ischemic attack. Individuals who have experienced a stroke or TIA are at higher risk for another stroke. TIAs, often called ministrokes, are serious warnings and require immediate medical attention. Understanding these risk factors can help in taking preventive measures to reduce the likelihood of a stroke. Now, let's talk about 10 warning signs of a stroke that can appear up to a month before it actually happens. Pay close attention. Symptom 1. Sudden vision problems. Vision issues such as blurred or double vision can be an early sign of a stroke. These problems may occur suddenly and affect one or both eyes. Sometimes, people might also experience loss of vision in one eye or see flashes of light. Such changes in vision can indicate that the brain's visual processing areas are affected. 2. Severe headaches. Sudden and severe headache, often described as the worst headache ever, can be a warning sign of a stroke. This type of headache can come on suddenly and is often accompanied by other symptoms like dizziness or nausea. It's important to note that these headaches are different from typical migraines or tension headaches. If the headache is abrupt and intense, seek medical help immediately. 3. Unexpected dizziness. Feeling dizzy or having trouble with balance and coordination can signal a stroke. This dizziness can make it difficult to walk or stand and may be accompanied by vertigo, where it feels like the room is spinning. Such symptoms suggest that the brain areas responsible for balance and spatial orientation are compromised. Persistent dizziness without an obvious cause warrants immediate medical attention. 4. Numbness or tingling. Numbness or a tingling sensation, particularly on one side of the body, is a significant stroke warning sign. This can affect the face, arm, or leg, and might feel like the affected limb has fallen asleep. It's crucial to recognize this as it often precedes more severe motor function issues. 5. Difficulty speaking. Speech difficulties, such as slurred or garbled speech, trouble finding the right words, or understanding speech, are common stroke symptoms. Aphasia, the inability to speak or understand language, can occur suddenly. These issues arise because strokes often affect the brain's language centers. If someone suddenly cannot speak clearly or understand others, it's essential to act fast. 6. Muscle weakness. Sudden muscle weakness, especially on one side of the body, can indicate a stroke. This weakness can make it difficult to lift an arm or maintain balance. Hemiparesis, weakness on one side, is a typical stroke symptom and can severely impact mobility. This weakness may be subtle at first but can rapidly progress. 7. Fatigue. Extreme, unusual fatigue can be a precursor to a stroke. This fatigue is more intense than regular tiredness and might be accompanied by other symptoms like dizziness or confusion. It's important not to dismiss this fatigue, especially if it's sudden and unexplained. Fatigue can indicate the brain's reduced efficiency due to compromised blood flow. 8. Unexplained confusion. Sudden confusion or trouble understanding familiar things can be a warning sign. This might manifest as difficulty following conversations, trouble with simple calculations, or not recognizing familiar faces. Cognitive confusion often points to the brain's frontal lobe being affected. This confusion can come on rapidly and without any obvious cause. 9. Trouble walking. Difficulty walking, stumbling, or losing balance can indicate a stroke. This can include a lack of coordination and sudden falls. These symptoms suggest that the brain areas responsible for motor control and balance are impacted. Even if the trouble walking is temporary, it's crucial to seek medical help immediately. 10. Facial drooping. One side of the face drooping or feeling numb is a classic sign of a stroke. This drooping can make it difficult to smile, and one eye might appear droopy. This occurs because the stroke affects the brain's control over the facial muscles. Recognizing these symptoms early and acting quickly by seeking medical help can greatly improve the chances of effective treatment and recovery from a stroke. If you notice any of these symptoms, remember the FAST acronym to take immediate action. F. Face drooping. A. Arm weakness. S. Speech difficulties. T. Time to call emergency services. Time is crucial. The quicker you act, the better the chances of recovery. How to treat stroke. Once a stroke is identified, treatments can include clot-busting medications, surgery, or other interventions to restore blood flow to the brain. Prevention is always better than cure. Here are some tips to lower your stroke risk. Maintain a healthy diet. Exercise regularly. Keep blood pressure in check. Avoid smoking and limit alcohol. Manage diabetes and heart conditions. Thanks for watching. Don't forget to like, subscribe, and hit that notification bell for more health tips.